Hello everyone, I am Dr. Ekta Romi, practicing on Baner Road, Pune and also attached to KEM Hospital, Pune. I will be talking about hand eczema, its causes and how to manage it. Hand eczema is characterized by dry, cracked patches of patches on our usually on the palms of our skin or even on the back side of our hands. We will see what the causes of hand eczema are, and also we will see how to prevent the hand eczema. In this video we will be looking at the causes of hand eczema, and also we will see what kind of preventive measures can be done to prevent it, and also some kind of treatments which are offered for hand eczema. The aim of the video is that you understand the kind of care that you need to take so that this condition remains in a kind of a good remission. So what is hand eczema? Hand eczema is a condition in which they will develop kind of patches on your palms, and which will be scaly at times, and they will be itchy, and there might be some cracks, and which those cracks may even be bleeding at times. The cause of hand eczema can be multifactorial. There may be a genetic tendency to develop hand eczema, and contact with sometimes contact with allergens or some kind of irritating substances can also start they'll trigger hand eczema. Hand eczema is not contagious, we have to understand. So there is no way that we can give it to anybody or we can get it from anybody. It is kind of a tendency of our own skin, and but it does have a very great psychological aspect on a person who is suffering from hand eczema. A person with hand eczema will have a very dry kind of a skin which may be flaking, or it may be having kind of some kind of fissures or cracks in it, some kind of bleeding. It will be itchy, there might be burning sensation associated with it. So basically there are 4 types of hand eczema which are most commonly seen. So the first one is a type of eczema which is seen in atopic kind of a skin. If a person had a tendency of developing rashes in childhood, that person may develop hand eczema later on. Another kind is with contact allergens. Any allergen that might be coming in contact with your skin, like nickel, cobalt, balsam peru, these kind of things can trigger the hand eczema. Third type will be an irritant contact dermatitis, which after sanitizers we saw a lot after COVID, and also any other kind of irritants when harsh soaps are used, hard detergents are used like for washing and cleaning purposes. And the fourth type is also very common, but many times it is difficult to recognize, is because of the protein like proteins which are present in many kind of like foods. At times it is usually like some kind of vegetables or some kind of fruits, they can trigger. It's especially like in cooks and like in housewives you see this, and there will be kind of a little burning sensation immediately, which will start like last from 30 minutes to 3 hours anytime once they have touched certain kinds of foods. And then later on, with repeated exposure to such kind of foods, they will develop hand eczema. So if you feel you are suffering from hand eczema, you need to consult your dermatologist, and the dermatologist would provide you with some basic skincare tips that you need to be using, and also give you medications which may be in the form of corticosteroid creams or vitamin D3 analog creams, and there might be sometimes oral medications which might be required for the treatment. Hand eczema can wax and wane because, as we know, there are so many triggers, and many times all these triggers can't be completely avoided. Basic skincare in case you are suffering from hand eczema. So cleansers have to be very mild, no harsh detergents to be used, and you have to avoid use of harsh detergents for washing vessels or clothes as far as possible, though it may not be possible completely. You may use gloves if possible for you with a rubber band, so that the water doesn't go inside. Also eczema can get triggered by too much wet work. So more than 2 hours a day your hands should not be in water for more than that much time. Avoid using sanitizers which are alcohol based. They will dry your skin and can trigger eczema. After you have washed your hands, you need to moisturize your hands with a good moisturizer, which is kind of like a cream or an ointment based kind of moisturizers you need to use. After washing, you need to moisturize your hand properly with creams. Not lotions may not be enough, and lotions after evaporating they leave water, so that will kind of worsen the eczema. So we don't want that. Barrier creams may be used once your eczema is under control and the skin has normalized. Barrier creams may be used for prevention, but not before the like if the skin is still sore, then barrier creams are to be avoided. If you are handling food like and you know that that kind of food is triggering your eczema, then you need to wash your hands immediately or use gloves as far as possible. Even long hours, even using gloves for long hours is is not recommended. In case you wear finger rings, you need to remove the finger rings when you are washing your hands, otherwise soap accumulates under the rings and can then also trigger hand eczema. I hope I have been able to give you some insight into the causes and to the prevent hand eczema. If you liked the video, please log on to DermaVidya for more details. If in case you are suffering from this condition or you feel you have this, please seek help of a dermatologist and please do not self-medicate.
For more such videos, visit or log into dermavidya.com.